You're listening to Health Professional Radio, and thank you for joining us today. My name is Wayne Bucklar, and my guest today is Emma Glassenbury. Emma's the accredited practicing dietitian at Dairy Australia, and she's here to talk to us about an initiative that Dairy Australia is undertaking currently. Emma, welcome to Health Professional Radio.
Thank you. Thank you for having me.
Now, Emma, why has Dairy Australia taken on the challenge of informing health professionals about nutrition?
So Dairy Australia has always had a credible health professional program. The reason being health professionals are a really important influencer group to get the right nutrition messages to patients. So patients view health professionals as a trusted and credible source of nutrition information. And with Australia's diet being out of balance, with over a third of the energy intake coming from junk foods, such as cakes, biscuits, chips, soft drinks, alcohol, and really not enough Australians getting enough of foods from the 5 food groups. So we know that 96% of Australians are not getting enough vegetables, and 90% of Australians are not having enough milk, cheese and yogurt each day. So what we have set up is a health professional program called Foods That Do Good to help health professionals get the right nutrition information, to help consumers get the right evidence-based nutrition information. So what we have found from health professional groups is that nutrition is a core component of their consultations. And in fact, in GP consultations, about 30% of them have a nutrition component or element, giving some form of dietary advice. But only 63% of GPs are aware of the Australian dietary guidelines. So by having this website and health professional program called foodsthatdogood.com.au, it's giving health professionals such as GPs a source of information to get the right information to consumers.
Now, Emma, which health professionals are you targeting and why?
So the health professional program predominantly targets GPs, dentists and dietitians. Mm-hmm. And the reason being is we've found that these health professional groups really provide quite a bit of nutrition education to their patients. However, the information and materials on the website that we've developed can really be used by anyone advising patients on nutrition. So for someone working in aged care, for instance, you can still access the website, and on the website's a nutrition calculator, which would give the serve recommendations for elderly over the age of 71. So there's really something for everyone there.
Now, apart from talking to us and other media outlets, Emma, how are you getting the information about nutrition out to health professionals?
Yeah, so Dairy Australia is trying to collaborate with other health organisations and nutritionists working in media and social media to try and promote the Foods That Do Good program. So as many health professional groups are aware of the program and the new website, foodsthatdogood.com.au. And what we hope people will do, will save it in their favourites and act as a resource for them for information, because what we're doing is keeping the website up to date with the latest evidence and regular blog posts as well.
Now, Emma, there are lots of websites that offer dietary advice. What makes Foods That Do Good different to other websites?
So what makes the Foods That Do Good website quite unique is that it provides nutrition information and resources for all 5 food groups. So it doesn't talk to one food group alone. So it has the evidence statements and recommendations for vegetables, fruit, milk, cheese and yogurt, grains and wholemeal foods, legumes and meats and chicken, fish. So find information about all the 5 food groups. The website contains practical, downloadable patient education fact sheets, a nutrition calculator based on the Australian dietary guidelines. So it's trying to provide lots of information in a simple, on-the-spot resource that's easy to understand and tailored specifically for patients based on age and gender, and also diseases that clinicians or health professionals would see.
You're listening to Health Professional Radio. My name is Wayne Bucklar, and my guest today is Emma Glassenbury. Emma's an accredited practicing dietitian with Dairy Australia, and we've been talking about a new website, www.foodsthatdogood.com.au. Emma, What would you like to see as the outcome of the Foods That Do Good website?
Yeah, so we know that patients are overwhelmed and confused by conflicting nutrition information out there. And so what we're trying to do is give health professionals the right information so they can help cut through this information and get back to the recommendations around food and nutrition based on the Australian Dietary Guidelines. So we would like to see health professionals use the website to access up-to-date information for their patients and get information about good nutrition to patients, because we know that this can therefore help reduce common and serious health conditions like heart disease, stroke, hypertension and type 2 diabetes. So we know that prevention is better than cure when we're trying to give nutrition and diet information.
Now, Emma, I notice in the information that I've been sent that the website is curated by Dairy Australia with input from health professionals and the various peak bodies representing the other 4 food groups. So this is a credible resource for clinicians.
Yeah, absolutely. So while the website has been produced and curated by Dairy Australia, as you mentioned, we've also asked other industry bodies to provide us with links to their resources and their fact sheets. We've also referenced the Australian Dietary Guidelines with the evidence statements for all the 5 food groups. So really we've used the scientific evidence as the foundation for the program, but we've linked with other industry bodies as well so people can get other resources, fact sheets and recipes in relation to other foods, not just dairy foods.
Emma, it's been good chatting with you today, and I do appreciate your time. Thanks for joining us on Health Professional Radio.
Thank you for having me.
Let me just give you those websites again if you've missed them on our way through. Emma was from Dairy Australia, and their website is www.dairyaustralia.com.au, but the Foods That Do Good website is at www.foodsthatdogood, all one word, .com.au. If you missed my chat today with Emma Glassenbury, practicing dietitian at Dairy Australia, the good news is we have a transcript on our website. We also have a sound archive, both with YouTube and with SoundCloud, and you can access all of those resources through the Health Professional Radio website, www.hpr.fm. My name is Wayne Bucklar. Thank you for joining us today.